Hello everybody, this is Hassan Nafid, your anatomy and physiology instructor at Madison College of Wisconsin. We're going to talk tonight about the skeletal system. The skeletal system does perform a lot of important functions to our body. It is the systems that form the foundation and the skeleton upon which other organs, other muscles are attached and supported. The skeletal system also is the system that helps our body to manufacture the components of the blood. These are red blood cells, white blood cells, and the platelets. All these components are made in the bone marrow. The skeletal system also is a storage area for a lot of essential elements and specifically for the calcium. The skeletal system also gives us a mean of movement. It is the system by which we navigate environment and move from place to place. The skeletal system can be divided into two big categories, the axial skeleton and the appendicular skeleton. Bones are also categorized based on the shape. There is about 206 bones in our body that are divided into four groups according to the shape they assume. We have long bones, and these have two ends. We have short bones. We have irregular bones, and we have flat bones. Let's take a look at the skeleton and find out all these structures and features of the skeletal system. Taking a look at the skeleton here, we are going to identify the two categories or the two parts of the skeletal system, the axial skeleton and the appendicular skeleton. The axial skeleton is formed from the skull, the facial bones, the thoracic cage, the vertebral column. I'm going to turn it around this way so you can see the bones of the vertebral column, and these are the cervical vertebrae, the thoracic vertebrae, and the lumbar vertebrae. I'm going to make it a little closer to you so you can take a look at the vertebrae. Here is our cervical vertebrae, 7 of them, the thoracic, which are 12 vertebrae, and the lumbar, which are 5. It goes also down. You are going to identify the sacral and the coccygeal vertebrae, and these are here. These are fused vertebrae, 5 in the sacral and 3 in the coccygeal vertebrae. These forms the axial skeleton. So again, the axial skeleton is formed by the bones of the skull, the vertebral column, the thoracic cavity, and the coccyx. This what is known as the axial skeleton. On the other side, the bones of the appendicular skeleton, these are the bones of the upper limb and the bones of the lower limb and the pelvic bones or the hip bones. The bones of the upper extremities, these are known as the upper limb bones. These are the humerus here and here, right and left, the ulna and radius, these two bones, and the bones of the hands. The bones of the lower limb, if you can take a look at them here, I'm going to move this a little bit over. We have the femur. This is the longest and the strongest bone in the body, the femur, and the bones of the lower leg, and these are the tibia and the fibula. I'm gonna show them to you in a second. Back again to the lower limbs. These are the bones. This is the femur. This is the tibia. It's more medial, and this is the fibula. Also, there is the bones of the foot, carpals and the metacarpal bones, and these are the bones of the appendicular skeleton. Again, upper limb, lower limb, and the pelvic bone. I'm going to turn it to the back so you can see the pelvic bones, and these are the bones that forms the hip. These are the ilium, the pubic bone, and the ischium. 3 of them fused together. There is very minimal movement or sometimes no movement in these joints except during some times like for during labor, where there is relaxation of the ligaments, and that will create a little very restricted form of movements in these bones. Taking a look at the thoracic cage or the bones of the thorax, these are the ribs and the sternum. The sternum, as you see here, does have its three parts. We have the manubrium, we have the body, and we have the xiphoid process here. Manubrium, body, and xiphoid process. The ribs are 12 ribs. The first 8 ribs are true ribs because they are connected to the sternum by a costal cartilage. These are the costal cartilage. Each one of these ribs from 1 to 8 has its own separate attachment to the sternum by costal cartilage. The last ones are known as the false ribs, and these are number 10, 9 and 10. These are called false ribs because they have one attachment. They share one attachment to the sternum. The last 2 ribs, that 11 and 12, as you see from here, they are known as the floating ribs. I'm going to turn the camera a little bit here and make a little magnification so you can take a look at them. So if you see here, these are the 2 last ribs we refer to as the floating ribs, and this has no attachment to any of the parts of the sternum, and they are called or known as the floating ribs. The skull is a type of flat bones. If you take a look at the skull bones are flat. I'm going to show you from inside. Take the vertex out. It's a flat bone. Also inside, you see it does have flat surface. So the skull is a type of a flat bone, while the femur and the tibia are examples of long bones. They have 2 ends. They have a diaphysis and they have 2 epiphyses, a distal and a proximal epiphysis. So these are examples of long bones. The tarsals and metatarsals, and these are the bones of the foot here, and bones of the hands or the wrist. These are examples of short bones. If you see, they're kind of short here, tarsals and metatarsals. On the other hand, the vertebrae are examples of irregular bone. If you see, it does assume an irregular surface or irregular shape. This is the lumbar vertebra, while this is one of the cervical vertebrae, and they are irregular in shape.